Let's dig into the big news of late last week and the weekend. We had been expecting a House vote last week for the repeal and replacement of Obamacare with the American Health Care Act. The vote did not have a chance of passing, and thus it was pulled. Donald Trump reportedly told Paul Ryan to pull it, or maybe it was Ryan's decision to pull it, depending on who you believe. Doesn't really matter. It's another embarrassment for the Trump administration and the Republican Congress so far. Let's start with the politics of it. More than 7 years and more than 60 House votes to repeal Obamacare when it had no chance because Obama would have vetoed it had the repeal passed the Senate. Years to come up with a plan, and Republicans failed 64 days into Trump's presidency to do what they all campaigned on, to repeal the Affordable Care Act. Countless promises from Trump to repeal it quickly and immediately. More on that later. And another failure. Is anybody really surprised that all along, when Republicans talked about repealing and replacing Obamacare, they never had a plan? Are you surprised by that, Pat?
It took them 7 years and they couldn't come up with anything. And they said that it was important that we repealed Obamacare because the popularity of that was maybe in the 40s, 45% or so.
Yeah.
The popularity of the American Health Care Act, their bill, was only 17%, far worse.
Right. Not to mention that the provisions of Obamacare are very popular. And that's why oftentimes, if you say, what do you think about political thing one? People will say, whatever, 40, 45%. If you say, what do you think about this provision? What do you think about that provision? What do you think about this other provision? Which are, of course, what make up that political policy. You have very, very high support. That's what's going on with Obamacare right now. This new plan, as Pat mentioned, is one that very few people liked. That doesn't mean Obamacare is secure nor perfect, nor that Republicans now like it. But clearly they are realizing that if you repeal Obamacare, it will have consequences. And those consequences might not be good. Which gets us into the healthcare aspect of this. All Affordable Care Act provisions, except for the mandate that everybody have health insurance, are very popular. You need the mandate to make the whole thing affordable, though. You really can't have the stuff people like without the mandate, and this has to do with risk pools and self-selection bias. If you allow only the people who want health insurance to have health insurance, you are going to create a self-selection bias where you will see people who most need insurance much more likely to actually buy insurance, and that's going to make it more expensive. There's a car insurance example, which is if you don't make car insurance mandatory, only people who believe that they are more likely to have to file claims, either for more erratic driving or because they speed more often or because they drive more miles, you will have an insured group that in total, their mean driving risk is higher. That means you have to charge more for insurance. This is just sort of basic math, Pat, that I think a lot of people don't get, and some Republicans pretend not to get, even though they do, which is you need everybody to be covered in order to keep prices lower than they would otherwise be.
That's how it works in the context of a for-profit health industry.
Oh, sure.
If we had single payer, we wouldn't need a mandate. It would just come out of your taxes.
And that's what I get to next. This Obamacare is a right-wing plan. Okay, it's a right-wing plan in that it was suggested in the 90s by right-wing think tanks. It's a right-wing plan in that the only really worthwhile changes to be made are liberal changes: public option, single payer, expanding, Medicare for all, universal coverage. People would lose coverage and premiums would go up in the short term. 10 years from now, supposedly they'd be lower under the AHA, but we know that our predictive ability for something so massive 10 years out is really pretty minimal. It failed because it deserved to fail, and it's exposing that Republicans are the incompetent party we've known them to be, but it should also expose that the changes to be made are changes that should move us to the left, not to the right. And we're going to be dealing with that more. And I also want to deal with Donald Trump's lies about the failure of the American Health Care Act.